Hello, and welcome to today's AFTD Educational Webinar on the current state of FTD. I am Esther Kane, AFTD's Support and Education Director. We are so happy you have chosen to join us today. We will get underway shortly, but first I want to mention a few housekeeping notes. If you encounter any technical issues, please write a message in the Q&A box. Someone working behind the scenes will try to address them. Time permitting, we will conduct a brief Q&A at the end of this webinar. To submit a question, enter it using the Q&A option. We will try to answer as many questions as we can. This webinar will be recorded and archived for later viewing on AFTD's YouTube page. Next slide. Now, I'd like to introduce you to our presenters today. Megan Busby is AFTD's new Director of Advocacy and Volunteer Engagement. She has spent years as an advocate for people with serious diseases and unmet needs, and has over 20 years of experience in advocacy relations, strategic partnerships, marketing, and communications. Megan works to develop and support AFTD's advocacy strategy, grow a national advocate network, and expand our volunteer base. Dr. Shana Dodge is AFTD's Director of Research Engagement. She works to ensure that clinical researchers and regulatory bodies understand the needs, priorities, and values of people directly impacted by FTD, and that people with FTD and their loved ones can make informed decisions about research participation. Finally, as already mentioned, I am Esther Kane, AFTD's Director of Support and Education. I work to ensure that AFTD support services and educational programs advance early diagnosis and improve access to quality care and effective support. I also work to ensure that clinical information provided to healthcare professionals and the AFTD community is current and accurate. Next slide. Let's start with the polling question. Right now, how confident do you feel about your ability to find information about FTD advocacy, support, and research? Give your answer on a scale of 1 to 10. Looks like you're all right. It looks like many of you are somewhat confident to be able to find the information that you need. I hope today that by the end of this presentation, you will feel more confident in how to find the information and support you need. Next slide. Next slide. So we can't dive into FTD without first expanding our understanding of dementia. So what is dementia? You may feel like you already know the answer to this question. Some think of dementia as a memory problem or a disease that primarily affects older adults. But this is not true of all diseases that cause dementia. Dementia is a general term for brain degeneration. It covers a broad number of diseases that interferes with day-to-day life. Dementia is not one specific disease, but it's several diseases. Many people can present with dementia in their 40s or 50s, and unfortunately, some even as young as 21. Dementia can be present without memory loss as a symptom, and dementia is progressive. It gets worse over time. Next slide. This slide shows us how different types of dementia can differ from the age of onset, symptom presentation, causes, and even prevalence. Because the different types of dementia are so diverse, the lived experience of someone with FTD can be very different than a person diagnosed with Alzheimer's. Treatment for one type of dementia may not help another type of dementia. And support needs can vary depending on age of onset, leading families to seek out FTD knowledgeable experts, support, and resources that understand their experience. Next slide. So what is FTD? Frontotemporal degeneration is a type of dementia. caused by a family of related diseases or disorders. Like I said earlier, symptoms typically begin between 45 and 64, although age of onset can range anywhere from 21 to 80. It is a leading cause of dementia for those under 60. Unfortunately, a genetic cause can be found in approximately 20% of those diagnosed. FTD initially presents different symptoms depending on where the disease starts in the brain. The most common early symptoms impact behavior, personality, communication, and unfortunately, it can take up to 3.5 years on average to be seen by a neurospecialist to make an FTD diagnosis. Because of the typical younger onset of FTD, many persons with FTD or their care partners can still be working with their medical insurance related to employment, still paying off a mortgage or other loans, be saving for retirement or paying for college for their children, or even still have kids at home. All of these typical midlife activities can be turned upside down by the onset of FTD symptoms and ultimately an FTD diagnosis. Next slide. So what is happening in the brain? FTD is caused by the accumulation of the proteins tau, TDP43, and sometimes FUS in the brain. Sometimes these proteins come from genetic changes in a person's DNA, and sometimes we don't know why these proteins are building up in the brain. Currently, we know very little about the risk factors that contribute to the development of FTD disorders. This includes the effect, if any, of environmental factors such as diet, stress, smoking, alcohol, and drug use, or exposure to chemicals and toxins. As the proteins build up in the brain, it leads to neuron death and ultimately brain atrophy in the frontal and temporal lobes of the brain. Next slide. PET scans may be used to evaluate different organs or tissues. And here you're going to see some PET scan images of people's brains. In general, red and yellow are areas of very high metabolic activity, so healthier brain areas. The green areas are moderate metabolic activity, and the blue areas are low metabolic activity. With this slide, the front of the brain is at the top of each brain image. In the FTD brain, we see significantly lower activity, specifically in the frontal lobes, and larger black areas reflect spaces in the brain, ventricles, and atrophy. Next slide. You may wonder how brain atrophy leads to the symptoms we see in FTD. Our brains are mini CPU units for our body. They control everything about us, how we think, how we move, how we speak, how we feel. The frontal lobes are located in the front of the brain, one in the right hemisphere and one in the left hemisphere. The frontal lobe in the left hemisphere is critical for motor control of speech. The frontal lobe is also responsible for judgment, personality, inhibitions, and a person's affect. That is why FTD, which starts in this part of the brain, can cause personality changes that we see so often. With behavioral variant FTD, noticeable behavioral and personality changes are often the first signs of the disease seen by the family. The frontal lobe also focuses on initiating action and physical movement. The temporal lobes are located on the sides of the brain almost directly under your temples. This area includes auditory, vestibular, visual, and linguistic functions. This area is also associated with language processing, whether it is written or spoken. The left lobe is primarily involved in understanding or comprehending language. So when we think of atrophy occurring in the frontal and temporal lobes of the brain, we can think about why we start to see some of the behaviors or symptoms that we see in FTD. Next slide. Frontotemporal degeneration is not caused by a single disease, but it's caused by a cluster of complex disorders. You may have heard of it referred to as Pick's disease, frontotemporal dementia, or frontotemporal degeneration. Frontotemporal degeneration is the overarching term to describe three main clinical presentations: initial changes in personality and behavior, language and communication, or movement and motor skills. Behavioral variant FTD is characterized by changes in personality or behavior. Primary progressive aphasia starts with language changes and is split into 3 subtypes: non-fluent agrammatic, semantic, and logopenic. Corticobasal syndrome and progressive supranuclear palsy are often called atypical Parkinsonism because of the way they affect movement. FTD ALS is very often caused by a genetic variant where some family members may have FTD, some have ALS, and others a combination of both. In general, symptoms vary among people with the same diagnosis. One person's experience with FTD can look very different from another person's. This is why you may hear us say, if you've met one person with FTD, you've only met one person with FTD. Next slide. The diagnosis of FTD is currently only definitively diagnosed by autopsy. Otherwise, individuals are given a clinical diagnosis of probable FTD. This diagnosis is made by imaging studies, neuropsychological testing, and evaluation of symptoms. In order to be diagnosed with behavioral variant FTD, 3 out of the 6 following symptoms must be present: apathy, disinhibition, loss of empathy, executive dysfunction, compulsive behavior, and hyperorality. Primary progressive behavior is first identified by changes in primary progressive aphasia is first identified by changes in word finding, understanding, formation, and order. And muscle weakness is seen in FTD ALS and muscle rigidity in corticobasal degeneration and progressive supranuclear palsy. Although diagnosis is made primarily by the first presenting symptoms individuals can experience, all symptoms with differing severity throughout the course of the disease can be present in an individual. Next slide. The causes of FTD are split into 3 categories. The majority of FTD appears to be sporadic. These are families with only one person diagnosed, no one else in the family has FTD or a related condition. The presumption is that relatives are not at risk. In these cases, scientists are still working to understand what is causing the disease. Familial FTD accounts for roughly 40% of people diagnosed. In these families, there are multiple people with FTD or a related condition, like ALS, which is genetically related to FTD, or a mental health diagnosis like anxiety or depression, or perhaps a problem with movement or language or another dementia. When we see FTD and related conditions cluster in a family, we refer to this as familial FTD. We cannot always identify a specific genetic cause in everyone with a family history of FTD, but we can identify an FTD causing genetic variant in approximately 20% of people diagnosed. When a specific genetic cause is identified, we refer to this as genetic FTD. Next slide. There are many genes known to cause FTD, with the 3 most common being C9orf72, MAPT, and GRN. There are several other genes that more rarely cause FTD, and there are likely other genes that have not yet been discovered but may soon be added to this list. C9orf72 is believed to be the most common genetic cause of FTD and is also a major cause of genetic ALS. Most of these genes can present with any of the symptoms associated with FTD. This means in one family, you may see a person with behavioral changes and another relative with language or movement problems. This is part of why FTD is so difficult to diagnose. Next slide. The family experience of FTD from first symptom to diagnosis can be laborious. With symptoms of this disease, such as anosognosia or lack of insight, those displaying symptoms may be unaware of the changes and believe nothing is wrong, adding additional complexity to the diagnostic process. On average, FTD can take up to 3.5 years to diagnose from symptom onset. And you can see on this slide how much longer that is than in other diseases. Families often report seeing up to 6 physicians before receiving a diagnosis. The most common misdiagnosis is depression with apathy, being one of the first symptoms present in many individuals. During this time, the person may be misdiagnosed and undergo ineffective treatments for some other condition. Next slide. A few years ago, AFTD did a study on the costs of FTD with responses from nearly 700 care partners and caregivers. Published in the Journal of Neurology in 2017, the study concluded that the average annual costs associated with FTD are roughly double those of Alzheimer's disease. 12 months prior to diagnosis, overall household income ranged from about $75,000 to $99,000. 12 months after diagnosis, income declined to the $50,000 to $60,000 range. 1 in 3 caregivers stops working after a loved one's FTD diagnosis. Common symptoms include decreased judgment and financial decision-making, which can compound financial problems. FTD caregiving can also require significant role changes in the family. There may be children, teens, or young adults still at home, or the care partner may be already caring for an aging parent. To summarize, an FTD diagnosis can create complex and difficult financial and social needs for the family. Next slide. In 2020, AFTD and the FTD Disorders Registry conducted a survey of over 1,800 people impacted by FTD. Data from that survey revealed that a majority of FTD caregivers care for loved ones more than 80 hours a week. 24% reported working full-time jobs. 22% reported caring for children and a person impacted by FTD, and 10% are caring for more than one person with FTD. AFTD, and we want you to know you are not alone. Through research, education, and advocacy, AFTD is working to provide hope. Please join me in welcoming Shana Dodge, AFTD's Director of Research Engagement.
Thank you so much, Esther. I'm really excited to speak with you all about FTD research today, and I'm going to start with launching a second poll. And I'd like you to respond with, I feel empowered to play a role in driving the science of FTD forward on a scale from strongly agree all the way to strongly disagree. And I'll give everyone a moment to respond to that poll. Oh, the numbers keep ticking up. I'll give you another few seconds. Wonderful, thank you. I'm going to end it there. It looks like the majority of you feel sort of neutral, with some people agreeing that they feel empowered and a few more strongly agreeing or disagreeing. And I hope by the end of today, you'll feel more empowered to drive the science of FTD forward. Next slide. So I want to start just by clarifying what we mean when we say research. Research is not the same as the medical care that Esther touched on. While the goal of medical care is to help you personally feel or get better, the goal of research is to answer important questions that can benefit everyone. However, your health is important to the research team, and regulations are in place to protect your safety, privacy, and confidentiality as a research volunteer. When we say research, there are lots of ways to participate in research and help increase our scientific understanding of FTD. There's survey research, like those the FTD Disorders Registry uses, and I'll talk about them in a bit. And those surveys help researchers better understand the lived experience of FTD, including how many people are impacted and what type of FTD they have, and where these researchers might want to consider placing research sites. There are also observational studies where researchers follow people impacted by FTD over time to better understand the disease and how we can potentially intervene. And you may have heard of the ALL-FTD study as an example of an observational study. There are also increasingly more caregiver studies that help us understand what it's like to care for someone with FTD and how that experience can be improved. There are also non-medical interventions, such as how things like speech therapy and positive behavioral support can improve FTD symptoms. There are clinical trials now testing experimental medications. And tissue and brain donation are also important ways to contribute to the science of FTD. Brain donation helps scientists better understand the underlying causes of FTD, and I'll talk about that later in this presentation. And it's important to know that opportunities are available for everyone. People diagnosed with FTD, current and former care partners, as well as biological family members. Next slide. So why might someone want to participate in research? Well, as you all well know, there is a huge unmet medical need for people impacted by FTD. We do not have any approved treatments, and research participation is the key to discover and test potential therapies. People in our community who have participated in research also tell us that participating in research can give them a sense of taking a more active role in their own care. And in some cases, participating in research can potentially improve your condition or quality of life. Participating in research can also sometimes grant you access to FTD interventions, specialists, or assessments that might not otherwise be available through typical clinical care. You may, through some research studies, be able to learn more about yourself or your condition through the results of tests you may undergo as part of research. And a big reason a lot of people participate is simply to help future generations by furthering our understanding of how to diagnose, prevent, treat, or cure FTD. Next slide. One important thing to recognize is that the state of FTD science and research has changed dramatically in the last few years. Many families impacted by FTD and even healthcare professionals are not aware of these exciting changes. While it is true that we do not yet have any approved treatments and our biomarkers are still in development, this is an exciting time. And just to touch on what biomarkers are, because you may hear about that when you're looking into FTD, biomarkers are things that you can measure that tell you about a person's health. So blood pressure is an example of a biomarker that tells us about cardiovascular health. While FTD biomarkers are still in development, they're really important when it comes to diagnosing FTD, determining if a drug is effective, and predicting when someone may develop symptoms. Today, in February 2024, we are closer than ever to having approved therapies and solid biomarkers. And some of these exciting changes include the fact that when it comes to clinical trials, we are at a place that was unimaginable just a decade ago. There are now a host of studies testing symptomatic treatments or medications that address the symptoms of FTD, as well as disease-modifying treatments that have the potential to actually slow or stop the progression of FTD entirely, including a clinical trial that's in phase 3, which is the closest we've gotten to having an approved treatment for some people with FTD. There's also a large and growing infrastructure with researchers in the US and all over the world, advocacy groups, federal programs, foundations, and industry partnerships that are working hard to find a cure. New genes associated with FTD continue to be discovered. For example, it was only about a decade ago that C9orf72 was identified as the most common cause of both genetic FTD and genetic ALS. There's also robust natural history data coming out of observational studies that are helping us better understand the progression of FTD and play an important role in driving these clinical trials forward. And with those observational studies, we are getting a better understanding of potential FTD biomarkers, including research that AFTD is funding. And the closer we can get to these validated biomarkers, the easier it will be for our community to access timely and accurate diagnoses and for us to intervene at earlier stages of the disease. And finally, there have been exciting approvals in other neurodegenerative and rare diseases, such as ALS and Friedreich's ataxia, that's helping to pave the way for approved FTD treatments. Next slide. A special note on clinical trials. Clinical trials are a type of research study that are specifically designed to determine the safety and effectiveness of new medical interventions, such as drugs, treatments, or medical devices. Every medication that we take has gone through the long and rigorous clinical trial process, and it can be very frustrating to wait as different drugs go through this lengthy drug development. However, the process is what helps ensure that drugs that do get approved are safe and effective. Every clinical trial is different in terms of the types of people that they're looking for, what it asks of participants, and in the potential benefits and risks that participation may bring. Before researchers begin to recruit, they're required to define a protocol that's reviewed by an ethical oversight board and other experts, and there are many regulations in place to protect the safety and privacy of volunteers. Right now, many of the clinical trials are focused on people with specific types of FTD, like FTD caused by the GR or PSP. And this is because researchers are more confident that they understand the underlying pathology or the proteins that are impacted in these cases. However, whether or not you or your family are eligible for the current trials, the results will have huge implications for everyone impacted by FTD. For example, what we learn scientifically about clearing away disease-causing proteins will be relevant for all people impacted by FTD. Meanwhile, medications for additional FTD genes and for sporadic FTD are also under development. The rate limiting factor right now is finding available participants. So even if you or your family aren't eligible or interested in participating in current trials, it's important to spread the word and make sure that anyone who's interested in participating understands the available opportunities. And I'll talk more about this a bit later in the presentation. Right now, I'm very pleased to introduce my colleague, Megan Busby, who joined AFTD last October as our Director of Advocacy and Volunteer Engagement, and she'll talk more about FTD advocacy.
Megan, you're muted.
Wow, rookie mistake. Thank you, Shayna. I'm really happy to be here with everyone this afternoon, and even happier to be a new member of the AFTD community. So I'm here to talk about advocacy, policy, what is it? How can you get involved? You may have noticed that AFTD has been sending out more information to everyone about advocacy, and you may already know what that means, or you may have absolutely no idea, what we're talking about yet, and that is totally fine. We are going to walk with you through every step of this process. And we are still in the process of building our advocacy pillar and program. So it's a really exciting time to get involved with advocacy here at AFTD. Next slide, please. So, what is advocacy? Well, there's many types of advocacy, right? Truthfully, many of you advocate every day, whether it's for yourself or your loved one or someone that is impacted by FTD. There's certainly advocating to your healthcare system, your healthcare provider, even just spreading awareness of FTD with friends and family, right? That is also advocacy. Talking about it, spreading the word, getting it out there. What we're really here to talk about, though, is what we would call policy advocacy. So in particular, the dictionary definition would be the act of promoting a particular cause, in this case, FTD, often with the goal of influencing policy or decision-making. So we are bringing voices together, right, to change public policies or laws that impact this community. And we can do so through many different tactics: letter writing, grassroots organizing, or e-advocacy, which is emailing your legislator, calling, texting, and then even going in person and meeting face-to-face with your federal legislator, whether that's in DC on Capitol Hill or in your district, in your hometown, or going to your state capitol and meeting with your state legislators face-to-face to talk about different policy issues or legislation. So the most direct form of advocacy is what we call lobbying, and that is taking a position on a specific piece of legislation. Next slide, please. Oh dear. Excuse me, sorry. So what is policy? Well, advocacy and policy really go hand in hand with one another. And policy is really an approach to solve a problem or an issue. And once those policies have been developed, again, whether it's legislation or a regulatory policy, then that's when we as advocates come into play, and we really play a critical role in promoting the adoption of those policies and the implementation of, again, policies and or legislation. Next slide, please. So why do we advocate? Well, Esther and Shana did a great job of sort of setting this up. Why do we advocate? Well, we advocate with you, of course, alongside you. We advocate on your behalf. We hear from our community and the different barriers that you may be faced with on a day-to-day basis. We know that it takes an average of 3.6 years to get a diagnosis. That is a huge why as to why we advocate. Another big why, needing increased funding or lack of funding for research on FTD. There are no current treatments, as you are aware, and as you have heard, there are not many state-supported services or effective state-supported services for people living with FTD or their caregivers. There are caregiving support and services at the state level, at the federal level. All of these reasons are why we advocate. And really, public policy advocacy is one of the most effective tools that we have for fighting FTD and its debilitating effect on families and everyone impacted. And so we really need to sort of create what I would call an advocacy movement. We need to use what we have, the voices that we have, our families, our friends, our passion, public opinion that we can influence to really make our case and mobilize all of these people, those in our support groups that we have, friends in other organizations. Shana was talking about the relationship with ALS. We can use all of this, and through meetings and the emails and the letters, all that e-advocacy, the face-to-face advocacy and lobbying, through blogs, social media, other public attention, we can really capture the attention of the real decision makers and of course the media. And so I would like to hear from all of you just to get a sense of where you are in your advocacy journey, how involved you've been currently in the past. And we have a poll that we'd like to launch to see all of the ways you've ever contacted one of your either state or federal legislators, and just select all that apply. So you have by email, you have by phone, you've actually met in person, you maybe have attended an advocacy or lobby day. I'll give you just a minute or two. I think you can probably end the poll, thank you, and share the results. So, I mean, this is very exciting to see that there are people that are out there doing it. As I suspected, the majority of folks have never contacted a state or federal legislator. And that is because, it can be quite intimidating, to be honest. And people sometimes, I think, forget that our legislators are really there to work with us, for us, and represent us in their states. And so it's really important that we build those relationships and we advocate for the things that we truly believe in and are going to make a difference. Next slide, please. So back in September, we launched a new, what we call our Advocacy Action Center on our website. And it is a platform that allows for you to, well, we would say, quote, take action. So we have certain pieces of legislation that we're currently monitoring and working to get passed into law. And this system allows you to send a templated email. It's very easy. We try to make it as easy as possible for folks to write to your legislators at the federal level regarding these two pieces of legislation. And these two pieces of legislation are connected. One is the National Alzheimer's Project Act, or NAPA, because in DC, everybody loves their acronyms. And the other is the Alzheimer's Bypass Budget. Both of these pieces of legislation include FTD. You may see Alzheimer's in the name of both. It does include other dementia, including FTD. And so the NAPA or National Alzheimer's Project Act was passed in 2012, and it's really a way to bring all of the governmental agencies together to collaborate and communicate and work together on improving dementia care and services across the country. And that is up for what we call reauthorization. So the bill was passed originally in 2012. It has what we call a sunset date in 2025, which means it will end if not passed and or reauthorized again. And so we do have the ability to write to your legislators about this. And accompanying that is the continuing the funding. So the funding aspect, we've got the reauthorization on bringing these governmental agencies and private stakeholders as well together, doing the work and implementing great services and work. But we also need the money to go along with it. And so there is what's called the bypass budget, which provides NIH the resources it really needs to continue to do this great work. That will also end in 2025. And so if you visit our Action Center, you will see it is on the Action Center, and you would be able to send emails to your legislators. Another thing that's not currently listed on this slide, but is something that is happening fast and furiously, is if for anyone on the call that lives in the state of New York, Senator Michelle Hinchy, who is a big champion of ours around FTD issues, has introduced a bill in the New York State Legislature that would provide for or require an FTD registry. And so it would require that all cases of FTD be reported to the state health department. And this is really important around accurate data, right? So we're very excited and grateful to Senator Michelle Hinchy, and there will be more information forthcoming on how you can specifically get involved if you are living in the state of New York. You could also email advocacy@vaftd.org, and we would be happy to provide more information. Next slide, please. Thank you. And so finally, if you are not already signed up to be an advocate with us, or at least, stay abreast of the opportunities, encourage you to join the advocacy network by the URL is on this slide, theaftd.org, get involved /advocate, sign up. It's a simple sign up form with your name and email address, and so that we can contact you. You can become part of our mailing list around advocacy opportunities. There's much more to come in the way of advocacy here at AFTD. Again, just really excited. One thing that we just rolled out or launched, not quite publicly yet, but it is on our website. We do have a awareness resolution toolkit on our website, and this would be for folks living in whichever state you are living in to use the toolkit to have an awareness resolution introduced in your state. Currently, there was one introduced in New York by Senator Michelle Hinchy last year, and there is one moving in California right now, which is very exciting. And so if we have other people across the country that are interested in securing an awareness resolution it's basically to honor or commemorate our FTD Awareness Week in September, officially in your state, we would be, again, thrilled to walk you through that process and get you more involved in that. So again, much more to come in the world of advocacy, and I hope that many of you will join me and us as we venture on this journey. And with that, I would love to welcome back my colleagues, Esther and Shana.
That was great, Megan and Shana. Thank you for sharing on both the topics of advocacy and research. And at this point, we really want to talk about how you can be empowered and how you can be empowered together with AFTD to end FTD. Next slide. So to learn more about advancements in research, how you can join AFTD advocacy work, we would like to invite you to register for the 2024 AFTD Education Conference taking place in Houston, Texas on Friday, May 3rd. This year, keynote speaker is New York State Senator Michelle Hinchey, which Megan was just talking to us about. We're very excited to have her come and talk to us about her personal experience with FTD, as well as the work that she's doing in advocating. This annual conference brings together persons affected by FTD, experts in the field, and other healthcare professionals for a full day of learning and conversation and connection. If you can't make it to Houston, you'll be able to follow along with our free live stream, and many sessions will be recorded for later viewing. To learn more or register, visit the website displayed on the website. On the screen. Next, I want to talk to you about AFTD's helpline. AFTD's helpline is a resource that is available for you to help you navigate the journey. As we can already tell, you have many questions that you need answering or things that you're curious about in your FTD experience. We don't always like the word journey, right? So staffed by social workers, the AFTD helpline is here to answer your FTD questions and support you. They can provide more information on subtypes of FTD, give guidance on managing a new diagnosis, help connect you to resources and support, and provide emotional support. You can call the helpline at 1-866-507-7222 toll free, Monday through Friday from 9 to 5, or you can email us with a question at any time at info@theaftd.org. Helping people affected by FTD to access the support they need is a core part of AFTD's mission. AFTD-specific support options are also a great way to continue to learn from care partners who may be facing the same things you are. There is a growing network of in-person support groups for care partners around the country, as well as a variety of remote support resources. More information can be found on our page, Support for Care Partners. FTD is a complex disease with emotional and practical challenges that can be overwhelming and isolating. You are not alone. There are others who want to walk with you. Next screen. And lastly, we want to make sure you are aware that AFTD has a Comstock grant program to support care partners and persons diagnosed in receiving education and learning about the disease, providing respite, as well as offering support to improve the quality of life of those diagnosed. Next slide.
Thank you, Esther. I want to reiterate that there are things you can do today to help drive the science of FTD forward. We recommend that everyone impacted by FTD, that includes persons diagnosed, care partners, and family members, as well as others, enroll in the FTD Disorders Registry. The registry is a secure platform that collects information about individuals impacted by FTD. And the registry helps accelerate clinical trials for all types of FTD because it allows scientists to learn about the range of causes and experiences of FTD. And that raises confidence amongst researchers that people are ready and willing to participate in research. The registry also quickly connects people to research opportunities as they emerge. The registry is currently undergoing a major platform upgrade that will expand its capabilities and improve its user experience. We also encourage people interested to look into participating in clinical trials, which, as I mentioned, is the only way we can find effective treatments. Enrolling in the registry is one way to stay informed about new clinical trials as they become available. And you can also let your clinical team know that you're interested in these opportunities. As many of these trials and potential future treatments will first be open to people with genetic FTD, you may want to consider genetic counseling to see if genetic testing may be right for you or your family. A genetic counselor can evaluate the likelihood that you or your family members have a FTD gene and can help you think through the benefits and risks of genetic testing. A genetic counselor can also provide ways to talk to other family members about genetic testing, privacy concerns, and more. It's important to note that genetic counseling does not always mean someone goes through with genetic testing. It's simply there as a support and an educational resource. You may also want to participate in other types of research, such as non-medical interventions. And you can find some of those opportunities by visiting AFTD's Studies Seeking Participants page or reaching out to our helpline. As I mentioned earlier, you may want to also consider enrolling in a brain donation program, and our website has additional information about these options. Brain tissue is critical for scientists to better understand FTD. It can also be a complicated and sensitive topic. So if this is something that you think you may be interested in, it's important to have conversations about this early on with your family. AFTD also works to ensure the lived experience of FTD is brought directly to researchers through initiatives such as focus groups and making sure that people impacted by FTD are at the table when scientific conversations are happening. If these are opportunities that you're interested in, again, reach out to AFTD's helpline to get connected to AFTD's research team. The field is rapidly evolving, so we encourage you to sign up for newsletters, stay connected with AFTD, and help spread the news about what's happening in FTD research. The more information you have, the better you'll be able to advocate for yourself and your family. And coming to today's webinar is a great step forward. Next slide.
Great. And if hopefully anything that I shared about advocacy throughout this webinar piqued your interest and you would like to learn more, specifically deep diving in training on how to go about meeting with your legislators, then please join us Tuesday, March 19th from 7 to 8 p.m. Eastern. It's a great first step that you can also take to get a little bit more involved with advocacy if you're still a little uncertain and unsure. Again, I recognize it can be an intimidating process to get involved in, but again, we're here to make it as easy as possible, and we are doing so by starting with this training webinar, and we hope that you will come and join us. Next slide.
Great. So at this point, we'll take some audience questions, and we already have quite a few in our Q&A channel. If you have additional questions, feel free to drop them in there, and we will answer as many as we can. Why don't we start? There were quite a few questions, and I'll direct this question to Esther about whether FTD might be caused by traumatic brain injury, concussion. Do we have any information about those kinds of events and their link to FTD?
Yeah, I mean, researchers are actively looking into the possible relationship between traumatic brain injury and neurodegenerative disorders. Ultimately, any injury to the brain can lead to damage similar to what we're going to see in FTD. But it's really important that we recognize that there are two very distinct different causes of the disease process. And then therefore, there's very important clinical and pathological differences between brain injury and FTD. And most people develop FTD have no history of brain injury. So more research needs to be done, and this is a wonderful place for people to be able to advocate to get more answers by participating in research.
Thank you, Esther. Another question came in, and I've heard this from other folks as well, asking about if my loved one is in a clinical trial, is it possible they'll be put on a placebo or not get the active drug? And I can answer that one. So a placebo is an inactive product. Sometimes you might hear it being called a sugar pill that doesn't have the active medication. And it allows researchers to understand if changes that they see are due to the medication itself or due to other factors, such as simply being involved in a study. Not all trials have a placebo group, and some trials will allow people who have been on the placebo to take that active medication after a certain amount of time has elapsed, and if the data shows that the medication is having a promising effect in the group that's taking it. So it's important to ask the study team if there is a chance of being put on a placebo, how many people in the study will be put on a placebo, and if there's an option of taking an active medication if interested, and that is often called an open label extension. Megan, there were a few questions here, and I know you may have answered this live, but maybe to reiterate, if someone today is interested in engaging in FTD advocacy or wants to stay informed about what's happening, what would you recommend they do?
I would recommend that they sign up on the Advocacy Action Center on our website so that we can capture their information to then keep them informed of opportunities that will be forthcoming. And I did get a couple of questions. The registration for the March 19th webinar is going out via email tomorrow. So keep an eye out for that and you'll be able to register starting tomorrow.
Great, thank you. Esther, there were a few questions about finding neurologists or other clinicians that specialize in FTD. Do you have any pointers?
Yeah, I think what's really important is some people have to shop around a little bit. AFTD does on our website have medical diagnostic centers that are specialists around the country. But for some people, there is a wait to get into these centers and to get a diagnosis. And so we recommend that you talk to your local neurologist. And we also recommend that you reach out to the helpline and other local support groups. Very often they know where accurate FTD diagnosis is happening around the country.
Great, thank you. And I saw a few different questions come in about costs of participating in research or whether travel is required. When it comes to costs, many studies will be free of charge to participate and may even compensate you for your time or for travel expenses. Again, this is an important question to ask the study team when you're in the process of deciding if participation is right for you. You may even want to ask about things again, like travel costs. Does parking cost money? Will you have to be buying your own meals or staying in a hotel? Is there anything that can help with things like childcare costs? So those are all questions you want to ask the study team. And similarly, when it comes to travel, there are some studies that don't require travel at all. Again, enrolling in the FTD Disorders Registry will give you the option of participating in survey research, which you can do from the comfort of your own home. There are also other studies that are additionally using computers, tablets, smartphones to enable participation in studies. And researchers are actively looking into ways that can reduce the number of visits that are required for studies that do require in-person visits, or looking into whether there are ways for study personnel to, for example, visit your home or for you to go to your local clinic rather than having to travel far. Again, all questions you want to ask, and ask whether any of those travel options will be covered and whether they'll be facilitated by the study team if travel is necessary or if that's something you have to set up yourself. Why don't we do maybe one more final question? Esther, what are support options that are available from people who come from families with genetic FTD? Because we understand that needs can be different for those with genetic FTD.
Yeah, the needs are very different and the support needs are very different. And I think finding a community and being able to talk to other people who understand your experience and what you're feeling is so important. This January, AFTD started our first support group specifically for people who have a known genetic variant of FTD. And it is on the first Wednesday of every month. It's facilitated by our manager of genetic initiatives, Kim Jenny, but is really peer-led, and it's an opportunity for people who know they have a known genetic risk to be in a safe spot and be able to have conversation with others who really understand. In addition, we're very excited to announce that we'll be starting our second support group for those who come from familial FTD. So whether you know that FTD runs in your family, but have chosen to test or not to test, this might be a great place for you to find other people who are in the same place as you, tackling with the issues of, do I want to find out? Do I not want to find out? And how it makes you feel and the emotions that are around that type of diagnosis. So that group will be starting in April, and you can reach out to the helpline to learn more.
Thank you, Esther. And I'll just make one more plug, because I do see a number of questions about how to find available clinical trials. You should already see a link to the FTD Disorders Registry in your chat. That is a great way to get connected to current clinical trials. I'm also including some more information from AFTD's website about finding research options. But we do recommend everyone join the registry and speak to your clinical team. Let your doctor know, let your neurologist know that that's something that you're interested in.
Can I answer one more question, Shana? There's been a lot of questions on here on how can I advocate with healthcare professionals to help them better understand FTD and what's happening. We know that FTD is not as well understood as other forms of dementia, which is why we started this conversation with dementia and showing the differences between the two types of diseases. And AFTD has many ways that you can help educate healthcare professionals. We have a CME program that we offer free of charge that you can share with healthcare providers in your network, as well as we have a new volunteer opportunity for those who really want to get into their community and educate neurologists. All of these are opportunities that you can reach out to the helpline, learn more about, or look on our website. But we encourage you and we advocate with you to please share the resources and information that AFTD develops with your community to better educate them on how to diagnose and care for those with FTD.
Thank you, Esther. And thank you both to Esther and Megan. I'd love to revisit our polling question from earlier before we wrap up. So after watching today's webinar, how confident do you now feel about your ability to find information about FTD advocacy, support, and research? And I'll give everyone a moment to respond to that. Wonderful. Well, I'm really happy to see that our numbers have really gone up, especially initially, those that rated a 10, it was only 8%, and now I see 35%. So I hope that this has been informative, and I really am so glad that you've all joined us today. This concludes today's webinar. Please let us know if you have any comments or questions about today's presentation. If you have any further questions about FTD, you can contact AFTD's helpline using the information on the screen. Thank you.